You have had premium lens surgery but are unhappy with your vision outcomes. You can be helped. Just this past week, we have seen another 10 patients who have traveled to us from all over the country and world, very unhappy and disappointed with their lens implants used for the cataract surgery in their radial keratotomy eyes. Please understand, as I keep teaching, eye surgeons all over the country and world, and I want every patient to be educated. There is no need to fall for advertising hype. Ask questions. Every lens implant is well made, but wasn't made for radial keratotomy eyes. Yes, you can see with them, but you have to use lensoplasty principles to take that cataract surgery to the next level, to fool the optics to make it see through your permanently broken, scarred, and incised arcade eye. That's the principle. If you're seeing with any particular lens without the experience or principles behind it, it just proves that your cornea from radial keratotomy was so normal that any lens would have worked. So for the real issues that you all are facing now, having had these premium lens implants and magical lenses that are advertised everywhere, you can still be helped. So don't despair. Most of these patients, I don't even have to remove their surgeon's lens implants or do any invasive surgeries. I use laser plastic techniques to then modify your radial keratotomy cornea to match the optics of your surgeon's lens inside the eye and make you see again without glasses or contact lenses. So in summary, don't despair even if you have fallen for advertising and lens implants and had a bad outcome. You can certainly be helped. You know where to find me. It's my passion to help radial keratotomy patients, having helped patients like you from all over the world over 3 decades. So you can visit us online. Our website is like an encyclopedia to give more and more knowledge. And you can always reach me for any questions. Dr. Gulani.